Good day, listeners, and welcome to DDM Health News Updates. On our program, Your Health, Your Wealth. In a decisive move to tackle the cholera outbreak, the Angolan government, with support from the World Health Organization, that is the WHO, has trained over 20 data management experts in Luanda. The training is part of efforts to strengthen surveillance, improve case detection, and enhance response strategies in the fight against the deadly disease called cholera. WHO acting representative in Angola, Dr. Zabulum Yotsi, said the initiative would sharpen expert skills in disease mapping and data analysis. Furthermore, the Ministry of Health, in collaboration with the WHO, is equipping data professionals with crucial knowledge, Yotsi stated. This will improve our ability to track cases, improve surveillance, and enhance response mechanisms. Definitely, health officials believe the newly trained personnel will play a critical role in managing the outbreak, particularly in Luanda, the hardest hit province all over. Angola's National Director of Public Health, Dr. Hega Frita, stressed the importance of data-driven decision-making in tackling the epidemic. These experts will strengthen cases, detection, and surveillance in affected areas, she said. Effective data management is key to guiding our response and ensuring timely intervention. However, cholera remains a serious health crisis in Angola, especially in densely populated urban areas such as Luanda. The country has recorded over 7,950 cases and 298 deaths across 14 provinces as of March 20th. The fatality rate stands at 3.8%. Luanda alone accounts for 52% of all reported cases and deaths, with poor sanitation and high population density worsening the spread. One of the newly trained experts, Rosa Astinho, described the training as a major boost to the fight against cholera. This is a great opportunity to improve my skills and contribute to better health outcomes, she said. With stronger data collection and analysis, we can respond more effectively, she added. WHO, alongside UNICEF, the Red Cross, and the World Bank, is supporting Angola's efforts in training health workers, providing water treatment solutions, improving sanitation, and organizing vaccination campaigns. Cholera, caused by the Vibrio cholerae bacterium, spreads through contaminated water and food all over the world. Experts say proper hygiene, clean water, and timely medical intervention are critical in preventing and controlling the disease. Authorities are calling for urgent multi-sectoral efforts to curb the outbreak and prevent further loss of lives. Next, Vice President Kashim Shettima, popularly known as the Vice President of Nigeria, has called on lawmakers across the country to enact laws that will strengthen nutrition and food security in Nigeria. The Vice President made this appeal on Wednesday while hosting members of the National Legislative Network on Nutrition and Food Security at the Presidential Villa in Abuja. The delegation was led by Honorable Chike Okafor, Chairman of the House of Representatives Committee on Nutrition and Food Security. Shettima emphasized the critical role of the legislature in ensuring the success of the Nutrition 774 initiative, a project championed by President Bola Tinubu's administration to improve coordination, financing, and accountability in the nutrition sector. According to him, this initiative aims to ensure that every Nigerian mother and child, no matter their location, can access to essential nutrition interventions tailored to their needs. For too long, our response to malnutrition has even been fragmented, donor-driven, and inconsistent. But the Nutrition 774 initiative, things are different. This is a government-led, government-funded, and government-implemented initiative because we understand that food security cannot be outsourced, Shettima stated. The Vice President further urged lawmakers to review and update existing laws that impact nutrition, including maternity leave policies to support infant nutrition and the removal of multiple taxation on food products to curb inflation. He stressed that while policies are important, action is what Nigeria truly needs. We have had enough reports, enough recommendations, and enough committees. What Nigeria needs now is action, he stated. Furthermore, Shettima highlighted that the federal government's efforts align with international development goals such as the United Nations Agenda 2030 and the African Union Agenda 2063. He assured Nigerians that the Nutrition 774 initiative is fully integrated into the country's broader national strategies, including the Economic Recovery and Growth Plan, the National Policy on Food and Nutrition, and also the National Policy on Food Safety.
To malnutrition have been fragmented, donor-driven, and inconsistent. Nutrition 774 changes that. It is government-led, government-funded, and government-implemented because we understand that food security cannot be outsourced. This N774 initiative is a beautiful idea, but the most important thing is let's walk the talk. Let's mobilize resources.
This initiative is not a standalone program. It is part of President Tinubu's larger strategy to build a Nigeria that can feed itself and nourish its peoples, he declared. The Vice President stated that the success of the initiative would not be measured by mere discussions, but by real-life impact. That is the action they are talking about, such as reducing child stunting, improving student concentration in schools, and ensuring that mothers and child receive proper nutrition for healthy childbirth. He also linked food insecurity to rising insecurity in the country, stressing that the regions worst affected by malnutrition are also the most vulnerable to violence and instability. When people struggle to eat, desperation sets in. And when young people are deprived of proper nutrition in childbirth, definitely it weakens their bodies and mind, with consequences that last from generations. He warns. Therefore, this is why investing in nutrition is not just a moral duty, but also a critical investment in national security, economic growth, and long-term stability. Earlier in the meeting, Honorable Chike Okafor highlighted the commitment of the National Assembly to reviewing and amending laws related to nutrition and food security. We have engaged the Conference of Speakers of the 36 states' houses of assembly, and today we are proud to announce that all states now have dedicated committees on nutrition and food security, Okafor revealed. Also, he noted that some of the proposed legislative reforms include extending maternity leave from 3 to 6 months to support infant nutrition. Truly, mothers will be very, very excited to hear this great news. Secondly, regulating the sale of bulk and potential adulterated vegetable oil in open market. Thirdly, addressing multiple taxation on food products transported across different regions. Additionally, Honorable Michael Ige, Majority Leader of the Ekiti State House of Assembly and Chairman of the National Legislative Network on Nutrition and Food Security, also spoke at the event. He praised the initiative, saying it provides a unified platform for state lawmakers to collaborate on nutrition policies. He further added that the integration of nutrition committees at the state level has given a structured approach to advancing nutrition programs across Nigeria, with the government and lawmakers aligning effort to strengthen food security. Stakeholders are hopeful that the Nutrition 774 initiative will mark a turning point in Nigerians' fight against malnutrition and hunger. Well, that's a wonderful news. This will be all on our program, Your Health, Your Wealth. I'm sure your health is always your wealth. Don't forget to click on the like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more news updates. Until next time, I remain your host, Nenyer Michaeline Ezine. Bye for now.